So, let's think about root causes. Why do people go? And this is sort of where you start in terms of trying to understand short-term trips. Modern technology and communication, right? Today we live in a world where within 30 hours you can be anywhere on this planet, right? And then the paradox is we live in a world that is more interconnected sort of in terms of communications and travel than ever before, but at the same time, if you're in university, if you're in medical school, you are more constrained by time and finances than ever before. Modern lifestyle is not kind on your free time, unfortunately. We have less free time than we've ever had as a society, collectively, and that's not saying much. But anyway, so the paradox is, especially for people who go through professional school, especially for people who go through university, which isn't cheap and it usually ends up with like decades of training, you have these scarce time and finances, you're often servicing debt, and you only have 1 week off from residency as an intern. So then, what are you going to do with it? If you're still keen on going, you're going to go, right? At the same time, training in limited skills may also keep you from contributing to a more longer-term position abroad. I think the best one that I really enjoyed for fun, there's one time my friends and I were out on a Friday night, and then we decided to just Google positions at the WHO, just to see if they'd hire us. It's like, oh yeah, you need to have 10 years of director-level experience at a national government institution in order to even come and work with us for 6 months. We're like, okay, that's cool. I guess that's not happening. So basically, it becomes a case of then you default to the short-term trip again, right? And then, like I said, the biggest thing the surveys show is actually people do really want to do good. Like they really do believe that if I'm going to do good, something is better than nothing. And it's the altruistic nature of sort of healthcare and the healthcare profession. I should also mention that a lot of the concerns that apply to sort of short-term volunteerism abroad can also apply to short-term volunteerism in disadvantaged communities right here in North America as well. Maybe to a lesser extent, but it's also still there. So the idea that good intentions, but in its current form, may not necessarily be realized. So this is why people go. And so what we're trying to do is essentially, like I said, the driving causes are clear. We know that this is happening. We know that people go abroad. We know that people go abroad with the best of intentions. They want to make a difference. We also know that there are clear benefits derived by the participants and the organizations that do it. And we also know that from an ethical perspective, these local communities that receive the volunteers and invest their bargain in the relationship, they deserve to have true lasting change, true lasting improvements in their health. And that the people who are going on these trips, with their limited time and finances, those also represent deeply personal investments. When you're going abroad, you're saying, I'm spending a week abroad, I'm going to probably spend a lot of money out of my own pocket for airfare, whatever, etc. The investments from both sides are kind of not really being realized right now. So we're saying that even if things don't necessarily work perfectly now, we agree with the problem, but our solution is different. Is there a way we can fix this? Is there a way we can make it better? So here's what we've tried out so far as an organization. What we did in La Romana is we basically developed a web-based collaboration platform. And since everything nowadays begins and ends with the internet, what we did is we basically reached out to the other 30 teams that head down to La Romana on an annual basis. And we basically said, wouldn't it be really neat if we even just started talking to each other? Because what we discovered is, and this is where you might be like, oh wait, there are 30 other teams that go down. That was the exact same reaction that we had. We were just like, oh, so we're not the only team that visits La Romana. There's actually 30 other medical teams that go down there. And we realized that with all these different short-term trips, we were duplicating efforts, even sometimes working at cross purposes, giving mixed messages to the local community in terms of health promotion and whatnot, especially with some of the other groups that may have different values or beliefs from us. What we did was we were saying, okay, let's try to come up with a web-based collaboration pilot, where essentially everyone gets on the same web platform, and we can share protocols, just share knowledge, just talk essentially. And then maybe down the line we can have like a common inventory, common project management, especially. And then the other big part of it is incorporating some local input. So basically having the local leaders who at this time they're basically, the local leadership in La Romana right now basically is runs amok trying to run all these teams and make sure that everyone has a good time. But we're just saying if we can actually crowdsource the information for teams going down there, maybe he doesn't need to reply to 5,000 emails a day and can actually start talking about long-term planning and long-term priority setting. So instead of going down and doing your own thing for a week, we're saying we can join our teams together, still retain our autonomy, but join a wider campaign to build something bigger than ourselves. The idea that instead of focusing on downstream stuff, the stuff that maybe takes longer than a week, you can do more sort of upstream, targeted, sustainable, longer-term interventions that might actually change the underlying determinants of health in the community. This is where we also developed as an organization the idea of this minimal standard advocacy, which is standing up for short-term trips. First of all, agreeing that short-term trips are going to happen, but saying that, knowing that short-term trips are going to happen, all these institutions and all these people are going on them. Is there a way that we can have a base minimum expectation as to how these trips should be run? How they could be ethically run, how they could be effectively run, and then making sure that those elements are always there in terms of training expectations and deliverables, pre-departure training, post-departure debriefs, and so on. And so we are actually working with partners to research what projects might be best suited for essentially this crowdsourced effort and these minimum standards that we're trying to implement. And I'll let Henry talk a little bit more about what we've been trying down in our